Hi, my name's Gemma. I'm the Countryside Engagement Ranger for the North Access team, and I'm here on the outskirts of Andover today to talk to you about ticks. So we're in quite a well-known spot for ticks today. There are various signs dotted around warning us of ticks. Now, what are ticks, I hear you say? Well, I have got a little model to show you. Ticks are arachnids. They've got 8 legs and they're parasites. Ticks feed on blood and they're really not fussy. They feed on blood using these lovely long jaws of theirs at the top here. They start off life in this kind of environment, so long grass is what they love. This meadow here during the summer gets up to about your knee level, which is perfect for ticks because they crawl up to the end of the grass and launch themselves off to attach to a host. So as I said, they're not fussy what they feed from and they will choose humans if necessary. So we need to be mindful when we're walking in areas like this that ticks are about. So what will happen when a tick latches onto you? Well, they start off very small, as you can see with the pictures, and then they engorge on your blood so they become larger. Once they drop off into your environment. So many of you with dogs and cats may have experienced this before, finding ticks on your floor where they've fed from your animal. What you need to be mindful of is where you go. So some people think that it only happens in rural countryside areas. Well, ticks can be found anywhere as long as the environment is right. Ticks like places where wildlife is. So they tend to really like deer and hedgehogs, for instance, or rabbits. They will travel on those animals, feed from those animals and drop off. So if you've got hedgehogs, for instance, going through your garden, you may likely have ticks as well if they've dropped off your hedgehog. So don't think it's just something that happens in the rural countryside. It can happen in urban environments as well. So I'm sure you've got lots of questions about ticks, how to prevent them, Lyme's disease, but who better to answer your questions than an NHS healthcare professional? So I'm going to introduce you to Lynn now. So I've got Lynn here who works with the NHS and she's going to answer some of our questions about ticks. So the first question that I have for you, Lynn, is about prevention. So prevention is obviously much better than cure. I've already spoken about the environment here, the fact we've got long grass and it does get longer. How would you say to people what's the best way of preventing a tick bite?
The best ways of preventing it are trying to stick to the paths, so the grass is often shorter there and the ticks like to stay just on the tips of the long grass. So if you stay on the paths you tend to have less risk of getting a tick. DEET, insect repellent. But of course sometimes these walks are inopportune, so yes. That might not be ideal, but if you know you're going to be going out and about and it's practical to, long trousers are one of the best things that you can do. Okay. Light colours as well, because it's easier to spot the ticks, and make sure when you get home or you get into the car that you brush your clothing down to try and remove any ticks from you.
Okay, great, thank you very much. Now, what if we did have a tick latch onto us? There are different ways of removing them. Some are better than others.
There are.
So what would you recommend?
So there are a lot of old wives' tales about using things like nail varnish remover, Vaseline, alcohol, to try and dab that on the tick. Don't do that. If you irritate the tick in that way, what the tick will do is in fact expel everything in its body inside you. So it basically will vomit its stomach contents into your wound, which is obviously what you don't want to do. So the best way to remove a tick is by using one of these tools that you have here. Okay. Is to try and get the tick body and get a firm hold on it. Now you need to be careful not to squeeze the body, because in squeezing the body that will irritate it again and might make it regurgitate its stomach contents.
So the hook process is best, isn't it? You slip it in around the twig and you twist.
Absolutely, and you twist. And the twist is really important if you can, because it's that twist that they think helps release the tick's teeth from inside. So when the tick is latched on, the head and the teeth are underneath the skin and it's the body you see on the outside, and you really don't want to leave the head inside. So trying to get underneath the body gently and then twisting and a sharp pull.
Because some people make the mistake of pulling, don't they? And that's where you get the head left in.
You can, and of course leaving the head in isn't a disaster on its own. They think that normally the body would expel the head on its own, and it can be quite traumatic to leave the head, but it does potentially increase the risk of infection if the head is left in.
Okay, thank you. We have got a couple of different methods of removing. So I showed you the tick hook. You can get tick hooks, guys, from any of your veterinary practices, Pets at Home, any pet shop basically, okay? So have a look for them. Equally, we do have another one. It's a tick card. So this basically goes into your wallet or purse because it fits in just like a credit card, and you've got the hook at the bottom there. There's so many ways of getting these things off of you, so just have a look out when you're next in one of those shops and try and buy one if you can for your first aid kit. So speaking from personal experience, I've had a tick on me before and I actually used the hook to remove it, and I was really fortunate. I didn't have any side effects, I had no long-lasting issues. But Lyme's disease is a big one, and you do hear about people getting a huge array of issues from Lyme's disease. Could you maybe just give us some information on Lyme's disease and how to be aware of it?
So not all ticks carry Lyme's disease. Lyme's disease, they think, is prevalent in about 20% of ticks in the population at the moment. Remember, these ticks feed on small animals, so they feed on rodents, hedgehogs, mice, they can feed on sheep, deer. They jump off them and they jump onto you, and this is where you run the risk of getting Lyme's disease. What we would say is always, if you've been bitten by a tick and you've removed the tick, it's worth making a note of when you were bitten by that tick. Most signs of Lyme's disease will develop within the first 2 weeks of being bitten by a tick, but they can develop up to 3 months later. So it's really handy if you become unwell that you're able to tell your medical professional, I was bitten by a tick, and the date you were bitten by a tick on. Okay. Early signs and symptoms, so there is a rash you can get. So it is normal when you've been bitten by a tick to get a tiny little bit of redness around the tick bite. That normally resolves in 48 hours. The kind of rash you get with Lyme's disease, we call it a bullseye rash, and that is often because it is like a big angry red circle around the outside and a bit paler on the inside. So if you start to develop that rash, then you need to see your medical professional straight away. Okay. Not everyone, however, gets that rash. So other symptoms, and it's very difficult, particularly in times of COVID, but the other symptoms can be flu-like symptoms. Okay. So it can be body aches, headaches, lethargy. That is probably one of the most common ones. If you develop those signs and symptoms and you have been bitten by a tick, it is really important to tell your medical professional. And if you have got these signs and symptoms, and we do think you've got Lyme's disease, it's really easy to treat. If we get it early enough, it's 3 weeks of antibiotics.
Great, that's good to know, thank you. And then just last one, is there a website that people could go to for further information if they're concerned they've got Lyme's disease or a tick bite? Is there somewhere we could direct people, please?
So if you go to www.nhs.uk, if you look on that website and put in Lyme's disease, that's the most updated page on there. So it has lots of links about what to do. It talks about tick removal, signs and symptoms of Lyme's disease. It also has a little attachment on the bottom to Public Health England. Okay. In times that are not COVID, you can send your ticks to Porton Down and they will analyse them. But they do describe on this website how they would want you to send it. I'm not sure at the moment if that's something they're overly keen that people do, but it is the most updated website and it can link you to outbreaks in your area.
Okay, thank you so much. Thank you so much for taking your time to meet with me today as well. Really appreciated. Thank you very much for tuning into that video. I hope you found it informative and I hope you found it useful. Really good information in there. If you liked what you saw and you want to see more from Countryside Services, hit the subscribe button. So in the meantime, goodbye.